eyes, ears, nose, throat, neck exam. I'm going to start by inspecting the hair, the quantity distribution, texture, and any pattern of loss. I'm also looking at the scalp for any scaliness or lesions. I'm also checking for any nits. What are nits? Huh?
Eggs.
Eggs, right? Lice eggs. So I'm going to be looking at the scalp. Also inspecting the skull in general for size, contour, and any asymmetry. I'm looking at the face, inspecting the expression, contours, any involuntary movements or asymmetry. Looking at the skin for any discoloration, lesions, and distribution of facial hair. And now this is the part that you might combine when you're inspecting the scalp, as I'm palpating the skull, just feeling for any deformities, depression, lumps, or tenderness. Okay, so I want you to go through the skull, feeling everywhere. And now, and this is where we go to the temporomandibular joint. So I'm going to come here to the TM joint, inspecting for any erythema or swelling. Any tenderness, can you open your mouth for me? She's got movement, yeah. Do you notice it like when you're chewing? Yeah. And that's it. I'm looking at the range of motion, make sure it's smooth, note any swelling, tenderness, snapping or clicking with palpation. I'm going to move on to the neck. I'm looking for, looking at the symmetry, noting any scars or masses. I'm looking at the trachea, making sure there's no deviation from midline. I'm also looking at the thyroid gland. Can you swallow for me? Noting symmetry. Now I'll palpate lymph nodes. Ooh, I did not specify on here. Okay, well, it's all of them. No. This goes really fast, okay? So you're already here doing the TM joint, right? So I'm gonna do preauricular nodes, tonsillar node, posterior auricular, occipital, coming around to the anterior cervical, posterior cervical, deep chains, and supraclavicular. Done. Oh yeah, come up to the submandibular and submental. Okay? Yes?
We have to know, like, say out loud the areas we're feeling.
Yeah, and that's what should be on the thing.
So if we don't,
Well, I'm gonna add it. Gonna add it. Okay, lymph nodes. I'm assessing size, shape, mobility, and consistency and tenderness. Again, just checking for tracheal deviation. Coming around here to the thyroid. I can't remember the words because the page is too far away from me. Noting size, symmetry, consistency, tenderness, nodules. Okay, I'm gonna move on to the ear exam. I'm gonna start with inspection. First, I'm gonna look at the auricles, looking for any deformity, masses, or skin lesions. I'll look at the back sides as well. And I'm palpate the auricles. I'm gonna feel for any tenderness or nodules or edema. I'm gonna also palpate the mastoid process and the tragus. And the same thing over here. The auricles, the tragus, and mastoid process. The gross auditory acuity test. So this is the whispered voice test, right? So we're going to stand behind the patient, slightly off center. I'm going to say a combination of letter, number, letter, and then you're going to repeat it back to me, okay?
A1C.
What's that?
A1C. Sorry, I just thought letter, number, letter.
A1C. A1C.
Good.
B2X. B2X.
All right. So that's gross auditory acuity. And then we're going to move on to the otoscopic exam. Again, holding it properly, right hand, right ear. I'm looking inside. I'm inspecting the tympanic membranes for color, contour, malleus, cone of light, and perforations. Looking at the ear canals for discharge, foreign bodies, erythema, edema, cerumen, masses. Good. Next, we're going to inspect the nose and sinuses. Externally, I'm looking at the nose, surface of the nose for asymmetry, lesions, or deformity. I'm going to be palpating the nose for any tenderness or masses. I'll do that when I'm doing the sinuses. I'm looking at the again, there's your patency. Also inspecting the internal nose for color, swelling, bleeding, exudates, ulcers, polyps. I'm looking at the septum for any deviation, inflammation, or perforation. Again, up here, I'm just going to palpate the nose for any areas of tenderness. I'm going to palpate the frontal sinuses, both sides, for any tenderness, and the maxillary sinuses. Again, another completely acceptable alternative is percussing sinuses. Okay, that's what I do clinically, but the OSCE exam asks for that, but either one's fine. Now I'm going to inspect the oropharynx, so start with the lips, looking at the color, moisture, lesions, cracking, scaliness. Open up big and wide, I'm looking at the color, any areas of pigmentation, ulcers, white patches, or nodules. And this is where you would take your 2x2, lasso the tongue, move the tongue to the side, up to the side, okay? Looking at the gums, the colors for swelling, the colors for any swelling, ulceration, bleeding, retraction. Looking at the teeth, again, tongue blade, you can move the cheeks to the side, okay? You're looking at the teeth for any caries, abnormal positioning, any missing teeth. We already looked at the tongue for color, lesions, texture. I'm going to look at the hard palate and pharynx. Open up, say all for me. Excellent. I'm inspecting the hard palate for colors, any lesions, masses. Looking at the soft palate and the uvula. Looking at the pharynx for color, swelling, lesions, symmetry. Also inspecting the tonsils for color, ulcers, swelling, symmetry, exudate. Now this is where you definitely want to have your gloves on, because you're going to feel inside the cheeks, along the gum line, floor of the mouth for any induration, and again, tenderness or loose teeth. All right, now we're going to move on to the eye exam. We're going to start with a visual acuity. So let's go ahead and start at, this is 6 feet. Okay, we'll start with 20/20. Can you read this line where?
LTFPH.
Excellent. Maybe I should do this. Go ahead and cover one of your eyes. I want you to read that line, but backwards.
There's like a glare, but HFTTL.
Okay. Let's do that again, but we're gonna go one row up.
Okay. JHDFO.
Okay. So she hit more than 50% on the 20/25 with her right eye. Okay, cover up the other eye. Okay, we're gonna start at that same line, this 20/25. Let's go ahead and read it forward.
CFDHJ.
Perfect. How about down here?
LTFPH.
Okay, so her left eye is doing the heavy lifting when she's looking with both eyes, okay? Great. Now we'll do visual field screening. So I just want you to look right at me, and I want you to tell me when you see my fingers wiggle. Excellent. Okay, we're assessing the lids.
Yeah, of course.
The lids for direction of eyelashes, discoloration, masses, lesions, or edema. I'm looking at the lacrimal apparatus on both eyes for any swelling or tearing. Looking at the conjunctiva and sclerae, both sides. Keep it down for me. Excellent. Looking at the color for any swelling, discharge, vascularity, or nodules. We're also looking at the cornea for any, and cornea and lenses for any opacities. Looking at the irises, assessing the depth of the anterior chamber, which really only do with the slit lamp, but we're just doing this on visual inspection on this one, okay? Now I'm looking at the pupils. For size, shape, symmetry, and reaction to light, both direct and consensual. And for accommodation as well, so I want you to focus right here. Good. And then we're looking at the corneal light reflection, both eyes, fantastic. And then I want you to follow this light with your head, not with your, nope, strike that, reverse it. Follow this with your eyes, not with your head, okay? We're looking at the extraocular movements, including convergence, conjugate gaze, nystagmus, and, oh wait, already, I missed all that. Oh yeah, no, that's fine. Okay, nystagmus, lid lag. Then we're going to move on to the final portion of our exam with the ophthalmoscopic exam. Darken the room, ask patient to focus on an object in the distance. I'm going to stand and use my hand correctly, hold ophthalmoscope, a 15-degree angle, find the red reflex, move closer, inspecting the optic disc for color, clarity of outline, size of physiologic cup, symmetry between eyes, and any pathway edema. Also inspecting the retina, distinguishing arteries from veins, arteriovenous junctions, and any lesions, masses, hemorrhages, or exudates. And lastly, looking at the fovea and macula for any exudates, hemorrhages, and cysts. Lastly, we're going to move on to some special testing for hearing. Somebody had a tuning fork. I saw it earlier. So we're going to be doing the Weber test first. And the way this is going to work is I'm going to make this ring and I'm going to put it on top of your head. And I want you to tell me if you're hearing it more on one side, like in one ear than the other, okay? Hear it right down the middle or one side or the other?
I can't really hear it at all.
Okay, great. So then the grader is going to say, well, what would a finding of hearing it on one side versus the other, when are you going to use this? And you say, I'm going to use this in unilateral hearing loss. It's going to help me differentiate between conductive and sensory neural hearing loss. And they're going to say, well, how do you tell if it's conductive versus sensory neural? Okay, and you would tell them. Now I'm going to do the RINA test. The RINA test can be used unilaterally or bilaterally for bilateral unilateral hearing loss. First, we're going to ring it, and what I want you to do is tell me when you stop hearing it. And then I'm going to move the tuning fork, and then again, I want you to tell me when you stop hearing it, okay?
Stop.
Okay. And the grader's going to say, well, what would your findings indicate? And I would say, well, if air conduction were longer than bone conduction, that's normal. Or it could indicate sensory neural hearing loss, especially if she's already come in saying, I'm having a hard time hearing, I'm having a hard time with hearing. If bone conduction is equal to or longer than air conduction, then I would say that's a conductive hearing loss, and that's it. That's the exam. Okay? Thank you. I know. Sorry. I apologize. I didn't have that memorized this
Then
time.
did you do the Weber?
Yeah, I'm making them do it, both of them. She did Weber first.
Oh,
Yep, we did
missed
Weber
that.
first. Yep. Any questions about any of that? Any particulars that you want me to drill down on? Yeah.
Should we do Renee in both or just one?
You can do it in both. Most of these special tests, we just make you do it on one side. If the grader says, can you do it on the other side, then you do it on the other side.
Do we need to do this one?
Oh, I forgot that, didn't I?
I'm sorry, I don't know what to call that, but it's.
Testing visual fields by confrontation. Yes. So you should be doing cover, that side, cover, on that side. Yep. Thank you. Okay, I appreciate that. Any other clarifications? Sorry, that was a very quick run through.
I just pronounced